Have you ever felt drunk without actually drinking alcohol? Sounds impossible, right? But what if we told you there is a rare medical condition that turns your body into a personal brewery, producing alcohol from the food you eat? Welcome to RareMed, where we explore the rarest of medical conditions that leave even the most seasoned medical professionals baffled. Today, we're diving into the fascinating world of Auto-Brewery Syndrome, a rare and mysterious condition that causes people to become drunk without drinking any alcohol. Auto-Brewery Syndrome, or ABS, is a condition in which yeast and bacteria in the gut convert carbohydrates into alcohol, leading to high levels of ethanol in the bloodstream. This condition has been linked to factors like prolonged antibiotic use, uncontrolled diabetes, and overgrowth of candida yeast in the gut. Symptoms can vary, but often include the smell of alcohol on the breath, fatigue, and brain fog. Think about a time when you've had one too many drinks and experienced symptoms like feeling dizzy, disoriented, or even slurring your speech. People with ABS can experience these same symptoms without consuming any alcohol at all. But this isn't just some quirky party trick. People with ABS often experience symptoms like brain fog, dizziness, and even blackouts. And that's not all. ABS can also lead to legal trouble if the person gets pulled over for driving under the influence, even though they haven't had anything to drink. But imagine living with this condition and not knowing what's wrong, being accused of being drunk at work or school, or not being able to drive safely. So, how is ABS diagnosed? Well, it can be challenging to diagnose, as the symptoms can be mistaken for alcohol intoxication or other medical conditions. However, definitive diagnosis can be made through blood alcohol level tests and breathalyzer tests, which show elevated levels of alcohol in the bloodstream despite not having consumed any alcohol. Once a diagnosis of ABS is made, treatment typically involves a combination of dietary changes, probiotics, and medications to suppress the growth of yeast and bacteria in the gut. One of the most important strategies for managing ABS is to avoid foods that contain high amounts of carbohydrates, such as bread, pasta, and sugary drinks. This can help to reduce the fermentation process in the gut and prevent the production of alcohol. Probiotics, which are supplements that contain live bacteria, can also be helpful in restoring the balance of healthy bacteria in the gut. They help reduce the overgrowth of yeast and bacteria that contribute to the production of alcohol. In some cases, antifungal or antibacterial medications may be prescribed to control the growth of yeast or bacteria based on lab results. Despite the challenges of living with ABS, there is hope for people with this condition. With proper diagnosis and interdisciplinary treatment, people are able to manage their symptoms and live a relatively normal life. It's important to note that ABS is a rare condition and can be difficult to diagnose. If you or someone you know may be experiencing symptoms of ABS, it's important to seek medical attention and talk to your doctor about your concerns. Thank you for watching this video on Auto-Brewery Syndrome. In our upcoming videos, we'll be discussing other fascinating and rare medical conditions. If you found this information interesting or informative, please like and subscribe to our channel for more content on rare medical conditions.